I'm Dr. Rick Greene, member of the medical school class of 1970 from the University of Virginia School of Medicine. And it's my great honor to host this series established by our Medical Alumni Association, which really honors our former faculty members. And today I'm really excited to be talking with a faculty member that I remember as a student, Dr. Martha Carpenter. Martha, thank you for being here.
Well, thank you.
I really appreciate it. You know, what I wanted to ask you, you of course spent a lot of time in Virginia. You grew up in Virginia.
That's right, Madison County.
In Madison County. You went to West Hampton. I even know what West Hampton is, of course, University of Richmond.
It's just become better and better down there, the University of Richmond.
And I know you've been very instrumental in that institution for many years. But luckily enough, you came here for medical school.
Right.
And you were in the class of 1959.
That's right.
You then gravitated to pediatrics, pediatric cardiology. What made you gravitate to those specialty areas?
Well, I guess I had a background in physics. I majored in math and physics and then was in graduate school and realized my friends in medicine were doing things that I liked better than physics. So I applied to the medical school. See, it was hard to get in medical school for women at that point, but I prevailed upon them and they took me. And because medicine was what I really liked to do. And when I saw a student this morning was quizzing me about what would be good for her to do. She's in her third year. I said, follow your passion, because there's an awful lot of work to do if you're going to be successful at anything, and make sure you're happy doing it. And I followed my passion, and I did it so successfully that I like to still do a little bit of it.
That is wonderful. And you're still obviously a mentor to not only women in medicine, which make up over half of the medical school class, but also men.
They finally realized the error of their ways.
Well, let me ask you, how many women were in your class in medicine?
4.
4 women.
That was more than most.
That was. What were the challenges that you faced, not only in medical school, but as a house officer being a woman?
Not very many. I mean,
you really didn't feel...
No, I didn't feel pressures.
Yeah.
I had been told by some people that came before me that there were some professors that were not real fond of women, so I just took note of that and made sure I tried to stay ahead of them. And so and the guys were great, you know. I really liked my classmates. As a resident, you know, I didn't feel that much pressure because, you know, I just got along well with whoever was there. The first time I felt pressure was after I was back here on the faculty, you know, competing for money and promotion and all that kind of thing. Until then, it was just do your job the best you can and see where things go. And I really didn't feel a lot of extra pressure from the guys until, you know, when you compete for money and position, that's when the pressure goes on.
That's well said. So it's obviously the university was a magnet to you coming back here for being on the faculty. But what about Charlottesville? What has Charlottesville meant to you?
Well, that was a great magnet because I'd grown up just 30 miles away. I really liked the outdoors and playing golf and tennis and that kind of thing. And Dr. Natus wanted me to stay on in Boston when I finished my fellowship. Well, that would have been a prestigious position. But I'd already accepted a job here, and I was afraid if I didn't come then, you know, it might be kind of hard to get back here sometime later. So I honored the job I had accepted and came on back, and have been very happy here.
What is it about an academic career that really excited you versus being in private practice and taking care of children and children's cardiac problems?
Well, I wanted to do pediatric cardiology, really congenital heart disease. That's what fascinated me. I knew in medical school I wanted to do cardiology, but I wasn't sure whether I wanted to do adult or pediatric cardiology. And Mac Birdsong, while I was an intern in internal medicine, he said, "You ought to be in pediatrics." I said, "Well, I do like pediatrics too." And I sort of explained to him that, because I had been to Boston, to Mass General, between my 3rd and 4th years in medical school. So I'd been to Mass General, and I went over to Children's to see what it was like. And I said, "You know, I would really like to go to Children's Hospital in Boston if I could get there, because I think they offer some of the best training anywhere." He says, "Well, I'll help you with that." I didn't know how powerful his help was, because when I went up to interview, the person in charge of the residency was Canon Ely from Suffolk, who, of course, is an alumnus of this medical school. Yes. And when I walked into his office and saw a picture of the rotunda on the wall, I thought, well, this may work. And of course I did go there and had wonderful training in both pediatrics and cardiology, because we got patients from all over the world with a great variety of problems, and that just made it fascinating and made the training that much better.
What are the 1 or 2 significant advances that you have seen in your career in the world of pediatric heart disease? What would you tell me?
Well, I think the very major advancement is the way imaging has improved so much. In order to make a definitive diagnosis, we had to do a cardiac cath, which is an invasive procedure. Once we had echo and better imaging, MRI and whatever, then we could do non-invasive procedures and probably not have to do a cath at all unless we wanted something very accurate that we could determine only by cath. So I would say imaging, not only in cardiology, where we use it a tremendous amount, but everything else, that advance has been amazing. And then for congenital heart disease, it's been the ability to repair so many of the cardiac lesions. And it's been a very exciting time to be in cardiology, to just watch all this advance as you're working in the field.
Did you ever think that we'd see the advances in pediatric cardiac transplant that we've seen today? Does that surprise you?
Well, people started talking about it, but it wasn't realistic because we just didn't know exactly how to handle, you know, the drugs that were necessary.
Yes.
But I think we always thought the transplant would be possible. As a matter of fact, we always just tried, if we didn't have a way in which to repair something, we tried to palliate it as well as possible, to try to keep a patient going until such time that there might be something better to do, that you could repair it, or when transplant was realistic, be able to transplant it. And we used to struggle with cardiomyopathy because, you know, you can't repair that, you can treat it, and so transplant was really the best option.
Have you had a chance to see any of these children as adults?
It's what?
Any of the children that you took care of with their cardiac issues now as adults come back to see you?
Oh, yes, I have. And
what a thrill that must be.
it is, because, you know, to see kids I took care of as newborns, and I still occasionally see a patient that I took care of as a newborn, and they're now 30, 40, 50, 60 years old,
Right.
have children of their own that I've also cared for. And that's the reward we've had, to be able to see this happen as time goes on. You feel like you really did something of value, maybe.
Absolutely. What do you enjoy doing outside of medicine today?
Well, I always enjoyed playing sports. So, although I can't play tennis anymore because I hurt my shoulder, and golf's a problem because my balance is not that good, I always enjoyed playing both tennis and golf. And if I can't play, then I like to watch sports.
I hope you watch Virginia basketball.
Of course. For a long time. And I've also watched football through
Absolutely.
thick and thin.
Yeah,
I think we're all very excited about that.
we are.
I was talking to Frank Quayle, and he couldn't be more excited about our new coach and his staff. So we have high hopes, but you always have high hopes before the season.
Absolutely.
I just hope they come true.
Well, I hope to see you at many games. It's been an absolute pleasure today to talk to Dr. Martha Carpenter, and for the Medical Alumni Association, I just want to thank you for everything you've done for the faculty here and everything you've done for the University School of Medicine.
Well, this is my chosen place to be, and I think that's what you should do, all you can.
Thank you so much for being with us.
You're welcome.